miasm is nothing but infection. Okay, it is an
हाँ हाँ
infection. Dr. Anand has
हाँ
clearly given it is an
I read that.
infection. So any
Yes. हाँ.
infection has these three qualities. I mean, there is a the time of infection, the moment when a person gets infected, then there will be an
हाँ.
incubation period, right? Incubation period,
Correct.
and
Correct.
then there will be first manifestation.
Hmm.
Okay, so the first
हाँ.
manifestation will always be on the skin in any infection. Okay,
Or even if it is olfactory or oral, when
huh.
primary, if you indigest something and then that goes into your GI tract
So
or
see, there
urine.
are two types of infection: acute infection and chronic infection.
हाँ.
Okay, so miasm is nothing but infection. So I will now use the word infection, so it will be more clear to you. Okay,
Okay.
huh.
Hmm.
So there are two types of infection: acute infection, chronic infection. Whether it is
Hmm.
acute infection or whether it is chronic infection, the progress will be same. I mean, first there will be time of infection. The moment we get infection, then there will be incubation period, and the
Hmm.
primary manifestation, the very first manifestation, will always be on the skin only. So
Hmm.
something
Hmm.
in the form of eruption we will get to see, whether it is acute or chronic infection. Now first I will give you example of acute infection. The typical example is chickenpox, measles,
Not
right?
skin related, sir, but related to abdomen and GI and urinary tract.
No, no. First, let me clear. कि
Okay.
acute
Okay, sir.
infection, the ideal example of acute infection is chickenpox, measles. The
Okay.
infections which the acute illness we say कि they give us lifelong immunity. Means once you got chickenpox, again you will never have in your life,
Hmm.
right?
Hmm.
So and
Hmm.
it is self-limiting. So it will complete its course of 5 to 7 days, and then that person will be free of that illness, that
Hmm.
infection. So that is acute infection. Now coming to chronic infection. So the chronic infection, there are two types of chronic infection. First is
Hmm.
venereal chronic infection and second is non-venereal chronic infection. Now venereal chronic
Hmm.
infection means a infection which we get after unprotected sexual contact.
Hmm. Hmm.
After unprotected sexual contact, we get the infection that is termed as venereal infection. That's a
Hmm.
chronic infection. So again,
Hmm.
in venereal chronic infection, there are two subtypes: psychosis venereal infection and syphilis venereal infection. So
Hmm.
psychosis
Hmm.
and syphilis infections we will have only and only after unprotected sexual contact. And those chronic infections which are not after sexual contact, they belong to non-venereal sora. That is termed as
Yeah.
non-venereal sora infection. Now, whether it is psychosis, venereal sora, venereal chronic infection or non-venereal chronic infection, first there will be time of infection, means the moment the
Hmm.
person gets infected with that venereal or non-venereal infection, then there will be some incubation period of 14 days or 7 days, and then there will be first manifestation on the skin in the form of some eruption.
Hmm.
So the very first manifestation for psora chronic infection or psora chronic miasm is itch vesicle. Itch vesicle means we will get to see the typical scabies.
Hmm.
Okay, it's a vesicle filled with transparent fluid initially, later on with pus, and the margin of the vesicle is very red, and it has severe itching, unbearable itching, followed by burning. So much itching that patient will feel like scratching, and he feels better by
Hmm.
scratching. The typical symptom of sulfur.
Hmm.
That is the primary manifestation of psora infection or psora miasm. And if we suppress this primary manifestation by applying some ointment or lotion, cream, okay, by allopathic doctors, then what happens? That primary manifestation will be suppressed, and then patient will come with either latent psora symptoms or develop secondary psora symptoms. So
Hmm.
unless and until you won't, I mean, till the time you don't disturb it by applying external ointment, the patient will be only in primary sora. If you suppress it, then patient will come with latent sora or secondary sora. So this is the
Yeah.
progress. Okay, and now coming to psychosis primary manifestation. The primary manifestation of psychosis is on the genital parts, okay, and that is cauliflower-like growth or figwort or
Mm.
cauliflower-like warts. That's the typical symptom of thuja, right?
Mm.
That is the
Mm.
primary manifestation of psychotic infection. And in syphilis infection, the primary manifestation is in the genitals, that is chancre or painful ulcer. That is the primary manifestation of syphilis infection.
But the what we get, what
Ha,
the black
ha,
color one, what
ha.
they are not syphilitic origin, right?
No, so any wart which is seen in the genital and which is having cauliflower-like appearance, that will be termed as venereal wart, and that is psychotic miasm wart.
Miasms.
And
Okay.
any wart
But usually
which is,
they use
huh.
warts on the face and warts on here and
So
there. They
these are
use puja for
sora, they belong to sora. Any
yeah,
wart
yeah.
which
That's what
does
I'm saying.
not have cauliflower-like appearance and seen in other parts. And suppose
Hmm.
there is a wart on genital, but if it has no cauliflower-like appearance, then it belongs to
Hmm.
sora.
Sura.
It has to, the feel is spongy. It has spongy feel of that wart plus a cauliflower-like appearance. Okay, and they easily bleed on touch, and the fishy odor is there from the discharge of that wart. That is psychotic, typical psychotic or venereal wart.
What
If
he said in the reading is chronic disease
huh,
that during your childhood, if your hand is broken or tooth is decayed or any fever or anything for that matter,
hmm,
which are of non-venereal in
hmm,
nature,
hmm,
you have suppressed with any kind of modality or any kind of
hmm,
treatments with
hmm,
allopathic treatment,
hmm,
they definitely got suppressed.
hmm.
So Sora is like from the birth. It starts
Yeah,
from
yes,
so that continues. And
yes,
we ourselves get the Sora
yeah,
suppressed in several ailments.
yeah, yeah,
So and now you are continuing suppressing it.
yeah, yeah.
So so now the primary Sora is already gone. The fever
Yes,
itself is gone long time.
yeah, long time. It's in till
And
in the
latent
infant
Sora
stage.
also gone.
Yes, yes,
By the time our age, that
yeah.
latent Sora is also almost gone. Now we are at the stage of
Secondary sora
uh,
or developed sora.
secondary Sora. So which can be prevented by taking a proper treatment at the
Antisoric treatment.
latent Sora level.
Yeah, yeah. Antisoric, proper antisoric treatment.